Good day everyone! Welcome to your virtual class. This is your teacher, Sir Rio, and today we are going to discuss and describe the different personal health issues and concerns. As a grade 6 pupil, many of you are experiencing changes in your body. That is because you are now approaching puberty. But what is puberty? It is the period during which adolescents reach maturity and become capable of reproduction. It is also the stage when your body experiences so many changes. It helps to know the hows and the whys of these changes one may experience so that you know what to expect. Because of these changes, many teenagers are having issues and concerns about their personal health. Now that you are approaching puberty, what are the personal health issues that you have experienced? What do you think are the cause of these health issues in concern? Look at these pictures. Using the table, describe each of them. Can you describe them to me? What can you say about their build? What can you see on their faces? Do they sway back or lean forward? Let us jot down the observations that we have by completing the table. Write your observations on the space provided. Okay, for picture number 1, what do you observe? He looks slim and leans forward. For picture number 2, okay, they have pimples and bruises on their skin. The third picture, what do you observe? Okay, the teeth are not properly aligned. The last picture, okay, he looks fat and he leans forward. And now, please give your 100% attention as we discuss the different health issues and concerns. The first in our list are the issues and concerns about height and weight. I know that some of you have questions like, why I am not tall as my classmate? Or why I am not as slim as my friend? Let us find out why. There are several factors you need to consider when it comes to height and weight, and these factors are as follows. The first one is what we call stunted growth. It is a reduced growth rate in human development. It is primary manifestation of malnutrition and recurrent infections such as diarrhea and helminthiasis in early childhood and even before birth, due to malnutrition during fetal development brought on by a malnourished mother. Next is underweight. It's a term describing a person whose body weight is considered too low to be healthy. Under the cutoff point at a BMI of 18.5, a person is considered underweight. The last height and weight related issue is what we call overweight and obesity, are defined as abnormal or excessive fat accumulation that presents a risk to health. Pre-obese and overweight, however, are often used interchangeably, thus giving overweight a common definition of a BMI of between 25 to 30. Your mom always tells you that you have to clean your ears regularly, right? What do you think so? Yes, even your ears can accumulate problems if you don't take good care of it. What are these ear problems? They are as follows. Okay, the first one is what we call impacted cerumen. It is when airwax or cerumen builds up in the ear and blocks the ear canal. It can cause temporary hearing loss and ear pain. Impacted cerumen should be removed by the doctor to help avoid damaging the ear. Treatment options include removing the airwax with instruments or by flushing the ear canal with special liquids. Okay, the next one is what we call swimmer's ear or otitis externa. It is the inflammation of the ear canal. It often presents with ear pain, redness, and swelling of the ear canal and occasionally decreased hearing. Typically, there are severe cases. Otitis externa is often referred to as swimmer's ear because repeated exposure to water can make the ear canal more vulnerable to inflammation. It is often brought on by water that remains in your ear after swimming, creating a moist environment that aids bacterial growth. Okay, the last hearing-related issue is what we call otitis media. It's a group of inflammatory diseases of the middle ear. The two main types are acute otitis media, AOM, and otitis media with diffusion, or OME. AOM is an infection of rapid onset that usually presents with ear pain. In young children, this may result in pulling at the ear, increased crying and poor sleep. Decreased eating and a fever may also be present. OME is typically not associated with symptoms. Occasionally, a feeling of fullness is described. You spend too much time playing games or watching too much video that your eye seems too tired to function. Did you know that this may cause eye problem? Let us find out what other eye problems teenagers experience nowadays. The first eye-related issue is what we call blurred vision. Refers to eye movement control and eye coordination. Something that is hazy and indistinct to the sight. Also a lack of sharpness of vision resulting in the inability to see fine detail. Blurred vision may result from abnormalities such as nearsightedness, farsightedness, presbyopia, or astigmatism that can be improved with corrective lenses or eyeglasses, or it may signal the presence of the eye disease. Okay, next eye-related issue is what we call astigmatism. It's a type of refracted error in which the eye does not focus light evenly on the retina. This results in distorted or blurred vision at all distance. Astigmatism is not caused or made worse by reading the poor light, sitting too close to the television, or squinting. Myopia or nearsightedness. It is a common vision condition in which you can see objects near to you clearly, but objects farther away are blurry. It occurs when the shape of your eye causes light rays to bend or refract incorrectly, focusing images in the front of your retina instead of on your retina. Hyperopia or farsightedness is a common vision condition in which you can see distant objects clearly, but objects nearby may be blurry. The degree of your farsightedness influences your focus ability. Xerophthalmia, from ancient Greek xeros, meaning dry, and ophthalmos, meaning eye, is a medical condition in which the eye fails to produce tears. It may be caused by vitamin A deficiency, which is sometimes used to describe the condition, although there may be other causes. Your body does not produce vitamin A on its own. Instead, you have to get vitamin A from the foods you eat. Vitamin A is essential for vision because it's an element of protein that absorbs light in the receptors in your retina. The next is what we call strabismus, more commonly known as cross-eyed or wall-eyed. Is a vision condition in which a person cannot align both eyes simultaneously under normal conditions. One or both of the eyes may turn in, out, up, or down. Skin disorders vary greatly in symptoms and severity. They can be temporary or permanent, and may be painless or painful. Some have situational causes, while others may be genetic. The following are different skin health-related issues and concerns that you may experience. The first skin-related issue is what we call sunburn. It's the term for red, sometimes swollen, and painful skin caused by overexposure to ultraviolet rays from the sun. Sunburn can vary from mild to severe. The extent depends on skin type and amount of exposure to the sun. Sunburn is a serious risk factor for skin cancer. Kerns are hard, thickened areas of the skin that typically occur in the feet. They are similar to a callus but are usually harder, smaller, and more painful. Kerns are not dangerous but they can cause irritation. They are also more likely to affect women than men. They are caused by excessive pressure or rubbing on the skin and can lead to foot problems, especially on walking. The common cause is wearing ill-fitting shoes. The last skin-related problem is what we call blisters. It's a small pocket of body fluid within the layers of the skin, typically caused by forceful rubbing, burning, freezing, chemical exposure, or infection. Blisters are most often caused by skin being damaged by friction or heat. Certain medical conditions also cause blisters to appear. The damaged upper layer of the skin or epidermis tears away from the layers beneath the fluid or serum collects in the space to create a blisters. As a pupil, you tend to carry heavy bags when going to school. Sometimes, you feel back pain and as time goes by, you notice that there's something wrong with the way you stand or walk. These issues can be related to posture and spine problems. The following are several posture and spine problems that teenagers have nowadays. The first posture and spine health related issue is what we call scoliosis. It's a sideways curvature of the spine that occurs most often during the growth spurt just before puberty. While scoliosis can be caused by conditions such as cerebral palsy and muscular dystrophy, the cause of most scoliosis is unknown. The next one is what we call lordosis. It's the normal inward lordoti curvature of the lumbar and cervical regions of the human spine. The normal outward curvature in the thoracic and sacral regions is termed kyphosis or kyphotic. The term comes from the Greek lordosis, from lordos means bent backward. The last posture and spine health related issue is what we call kyphosis. It's a spinal disorder in which an excessive outward curve of the spine results in an abnormal rounding of the upper back. The condition is sometimes known as the round back, or in the case of a severe curve as hunchback. Kyphosis can occur at any age but is common during adolescence. Have you visited your dentist lately? Have you had your teeth cleaned recently? If you don't, then you are prone to the following oral and dental problems. The first oral and dental health issue is what we call cavities, arcade areas of your teeth that develop into tiny openings or holes. The three types of cavities are shown here. Smooth surface cavities occur on the smooth sides of your teeth, while root cavities develop on the surface over the roots. Pit and fissures cavities occur on the chewing surface of your teeth. The next one is what we call gingivitis. It's a common and mild form of gum disease or periodontal disease that causes irritation, redness, and swelling or inflammation of your gingiva, the part of your gum around the base of your teeth. It's important to take gingivitis seriously and treat it promptly. Another oral and dental health issue is what we call periodontitis. It's a severe gum infection that can lead to tooth loss and other serious health complications. Periodontitis, also called gum disease, is a serious gum infection that damages the soft tissue and without treatment can destroy the bone that supports your teeth. Malocclusion is a misalignment or incorrect relation between the teeth of the two dental arches when they approach each other as the jaws close. The last oral and dental health issue is what we call halitosis. It's a condition in which a person emanates an unattractive odor from their mouth. This is often called bad breath. Bad breath can occasionally stem from small stones that form in the tonsils and are covered with bacteria that produce odor. And now that we are through with our journey discussing different health issues and concern, let me ask you, what are personal health issues and how to handle it? Okay, personal health issues, referred to as protected health information, generally refers to demographic information, medical history, test and laboratory results, insurance information, and other data that a healthcare professional collects to identify an individual and determine appropriate care. To handle those issues, You need to make lifestyle choices that can build resistance to disease and help overcome illness by choosing good nutrition and diet, exercising regularly or medication, getting adequate sleep and rest, practicing good dental hygiene, learning to lift heavy items correctly, and managing stress and anxiety. Okay, to find out if you fully understand the lesson, let's do the following task. Okay, the instruction is, guess the name of the pictures of personal health issues. The letters of the word are jumbled. Rearrange the letters to form the name of each picture. Okay, so our first picture. So what kind of health issue is shown? Here are the jumbled letters. Okay, so that is strabismus. Here is the second picture. So what kind of health issue is shown? Here are the jumbled letters. Okay, so that is obesity. Here is the third picture. So what kind of health issue is shown? Here are the jumbled letters. So that is stunted growth. Okay, the next one. So what kind of health issue is shown? Here are the jumbled letters. Okay, so that is halitosis. Okay, the last picture. So what kind of health issue is shown? Here are the jumbled letters. So that is kyphosis. Okay, for you to familiarize and know more about different personal health issues and concerns, let's do another task. Identify the personal health issues and concerns that may arise in each situation. Okay, for number 1, Scarlett loves to eat fatty foods but hates to exercise. So the health issues that may arise in the situation is, okay, obesity. For number 2, James uses his phone more than 8 hours a day in the dark. So James may acquire, okay, blurred vision. Number 3, Jacob always carries heavy bag on his back when going to school. So what personal health issue that may arise in this situation? Okay, Jacob may acquire, okay, kyphosis. Number 4, Hannah loves to swim. There are times when pool water goes inside his ears. Okay, so the personal health issue that may arise in situation is, okay, otitis externa, or what we call the swimmer's ear. Last, number 5, Ethan loves to play outdoors during noontime without any sunscreen protection. So Ethan may acquire, okay, sunburn. Okay, your next task is underline the word that makes its statement correct. Okay, for number 1, bad breath or halitosis is caused by certain foods or poor oral, facial, mental hygiene. Okay, so the answer is, okay, oral. Number 2, stunted growth means the normal growth rate in a person has been increased, reduced. Okay, so the correct answer is reduce. Next, number 3, people with hyperopia can see objects that are far, near, but have problems seeing objects that are far or close. So the correct answer is, okay, so they can see objects far but have problems seeing objects that are, okay, close. Next, number 4, otitis media is common in children because the tube that allows fresh air in the upper ear, middle ear, is not fully developed compared with adults. Okay, the correct answer is, okay, middle ear. Next, last, number 5, overweight is 15% to 20% above or below normal age and height group. Okay, the correct answer, above. As a reflection of what we have learned for today, on your journal, list down at least 5 personal health issues common in your community or in your family, and write your personal insights about it using the prompt below. I understand that. Then next, I realize that.
Okay, that's all for now, and leaving you with this message. Always remember, health is wealth and healthy is happy. Hope you enjoy watching and listening with this topic. Good day and God bless. Bye-bye.